This is a Fox News alert. It is official. The Obama administration just announcing it is granting a 6-week extension until March 31st for Americans to sign up for Obamacare and avoid penalties. Now, the extension was expected since HHS said they plan to do it as technical problems continue to plague the website. Also tonight, many young Americans, they're laughing at Obamacare. So what makes you think they would buy insurance on the exchanges if they are busy laughing at it? And if they don't, you tell me, where are we going to get the money?
We're probably just overloaded with traffic. Millions of Americans are visiting healthcare.gov, which is great news. Unfortunately, the site was only designed to handle 6 users at a time.
Secretary Sebelius, in her comments, she's already the laughingstock of America.
I have a number of friendly tips to help you deal with those technical problems. For example, have you tried restarting your computer?
Why didn't she know that the president's signature legislation was in fact in trouble?
The incompetence in building this website is staggering.
We don't need the government running our health care.
She's lost considerable credibility.
Be sure to like us on Facebook. Oh, look at that! We're already up to 3 likes. And I like that enthusiasm.
A big new glitch knocks out the Obamacare websites, halting online enrollment for all 50 states. This computer crash comes just a couple of days after HHS Secretary Kathleen Sebelius assured reporters that the online experience is getting better.
This isn't about a website, it's about making sure that millions of Americans have access to affordable health insurance.
Now, the president said I could keep my doctor and keep my health insurance. Apparently that's not true.
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period.
That promise is being broken.
If you like your health care plan, you'll be able to keep your health care plan.
You're no longer eligible to buy your own plan, which was the #1 promise that the president made to the American people.
You
cannot get what you have.
Most people are going to keep their own plan, Senator, and you know that.
That's not true.
They were promised they get to keep the doctor they have, and under bronze plans and some of these plans, there's no way they're going to get to keep them.
What the president said is turning out to be a falsehood.
Well, you heard right. Republican Senator John Barrasso calling HHS Secretary Kathleen Sebelius the laughingstock of America. Senator Barrasso joined us. Nice to see you, sir.
Thanks for having me.
Before I ask you about your thoughts on the Secretary, I'm curious your thoughts about the president the Obama administration has now delayed 6 weeks the enrollment. You like that?
This is a law that the president continues to figure isn't the law. He continues to make changes. This is about the 14th time he's made some change in the law. I support legislation to actually give every American an opportunity to delay it for a year. I think we ought to remove this individual mandate permanently.
Well, it's so interesting because I think it was Senator Mike Lee who I had a conversation with. He said that the law has been, quote, amended so many times, whether people getting exemptions or postponements or waivers, that there have been so many changes in the law that it's not the law that was passed by Congress, whether you like it or not. Do you feel the same way as he does on that?
Well, I do feel that way, and if we're going to make changes in the law, we ought to do it legislatively without the president just deciding that he can do it. But, you know, I'm a doctor. I want to make sure that Americans get affordable care without all these regulations, mandates, taxes, and there are ways that we can do it. But what we're seeing now with this health care law and so much attention is to the website. The website is really just the tip of the iceberg. There are big problems coming with this, Greta.
Should Secretary Sebelius step down or be fired?
Well, the president gets to make that decision.
I know, but what do you think?
I have called for her resignation. I think when Jon Stewart and Saturday Night Live are making fun of the job that you are doing and the website, you know, what that speaks to is the fact that young Americans are laughing at the secretary and the website. These are the people that the president is trying to coerce into buying insurance that's more expensive and more insurance that they want or need, and in many cases can afford. That's the only way that you pay for the insurance for these older, sicker individuals to make these younger people buy it.
At this point, though, what would be achieved by that? I mean, if she were, you know, if the president said you got to go or she decided to go, what would be achieved?
Well, the president has called his administration open, accountable, transparent. I think she ought to come and be honest with the American people.
How many people? Thursday.
We'll see what she says. How many people have signed up? She won't tell us that. Saturday, 2 days ago, she said, well, things are going well. And within a day, things crash again with the with the website and their data hub. So I think that she's lost so much credibility with the American people, it's hard to take it seriously. But the problem isn't just the website. Ultimately, they're going to get this fixed. People across the country are seeing that their premiums are going up. They're receiving cancellation notices of their insurance. More people since October 1st have gotten cancellation notices, Greta, than have been able to sign on.
If you had a chance, you're going to testify Wednesday, not Thursday. If you had a chance to question her on Wednesday, what would you ask her?
Yeah. What went wrong? When are you going to give us real answers? We ought to be able to do an internet age, know how many people have signed up every day, what zip code they're from.
That's what I want to know. How many people have signed up? Because that, that's the one thing. And what did they sign up as, to get subsidies or Medicaid? I mean, I'd like the different categories to figure out whether or not we can do the funding on this. Where the money's coming from. That's what I'm interested in.
It doesn't sound like they're buying insurance, actually paying for insurance. It sounds like many more are signing up for Medicaid, which is paid for by the government, but more people, I say, are getting termination notices, cancellation of their coverage. People are having a harder time finding a doctor. This is ripe for fraud and actually identity theft. So these are the things that are coming down the line. It looks to me like we're going to end up in what's called an insurance death spiral, because if the young, healthy people don't pay more for their insurance, and you have older, sicker people, that's going to go down, and then you're looking at, to me, a massive government bailout of this entire health care law.
Senator, thanks, sir. Nice to see you.
Thanks for having me.